It was kind of good to see all my classmates' faces, but kind of a little weird.
Nobody likes masks, but a lot of people think they're still a good idea.
Monday marked the first day that face masks were optional in schools across the state. The statewide indoor mask mandate is officially in the rearview mirror, but not everyone is comfortable with the idea of not wearing one.
Yes, we spoke with Chayton Sony yesterday, a kid in high school, representative of the Seattle Student Union. He and several other students voicing their concerns about removing the mask mandate now. Here's a portion of what he told us.
So it's our concrete belief that the district should lift the mask mandate 2 weeks after spring break, just because people are traveling over that spring break. And unfortunately, we will see a spike of cases if that mask mandate is not in effect after that spring break, just like we saw during winter break.
So joining us live this morning, State Superintendent of Schools, Chris Reykdal. Superintendent, thanks for joining us this morning. Can you hear us?
Yeah, good morning.
Good of you to be with us. Thank you so much. What do you have to say to that young man and those who are wondering that these mandates are getting lifted too early, and why not after spring break?
Well, the data was really clear beginning about 4 or 5 weeks ago with a precipitous drop in cases in our state. And again, if you remember going back 2 years ago, this was all about hospitalizations. Keeping our infection levels low to the point that they don't impact hospitals, and we've certainly achieved that benchmark. We're well below the Delta levels. I think there's always risk, and this student really points out that certain behaviors like traveling and densely packed gatherings are still going to create some risk. So I would encourage folks who are traveling, who are on airplanes, public transportation, even the grocery store, for your fellow Washingtonians, keep wearing your mask voluntarily. That's a good idea to do in those mass gathering settings.
And as we take a look at the cases and the level at which they're dropping, it's really encouraging. But with everybody, lifting this mask mandate, we might see cases climb. Is there a plan to reinstate the mask mandate if that's the case? And then what metric would that be?
Yeah, this really moves to local public health. So I don't anticipate a statewide order at all. It's certainly up to the governor if he should ever do that. But the whole purpose of this was to create both infection-acquired immunity and vaccine immunity so that we could begin to normalize our lives, knowing that sometimes in some communities there might be a public health officer who says there's an outbreak significant enough that we're going to reinstate masks or maybe even close certain facilities. So it's really shifting to local health officers. And again, I don't anticipate that, but it is very possible. We've got Omicron B out there in Europe now. I think we can expect it to come here. Fortunately, does not appear to be creating any more severe infection. And vaccines are still the absolute best way to protect yourself and your fellow Washingtonians.
And as we just reported too, China now dealing with a horrible spike in COVID cases there in some of their local cities. One of the big problems we've seen previously during this pandemic was staffing shortages. If a teacher gets sick, they're out for days or weeks, and there are few people to replace that teacher. What is in the works now to make sure you're protected if staff get sick?
It's still a really tenuous situation for our staffing. And it's, even without COVID, we would be in this very complicated place just due to competition for talent. And it's been there for a long time. So what happens now is really an infected student or staff member needs to be out for 5 days after a positive infection. And then they can come back after those 5 days if they follow one of basically 3 mitigation strategies. So I don't expect, again, that to get the way it was in January as we came back off of the holidays. But there's going to be some cases where that is going to be the result. And most districts will flip temporarily to remote learning for 5 days or 7 days or 10 days if there's an outbreak significant enough amongst their staff.
So all the districts, they have the option to lift the mask mandate within their own district. And a lot of them are following the guidance of State Department of Health right now in lifting the mandates. Do you know if there are some districts or how many of them have actually kept the mandates in place?
It's a great question. We don't actually monitor that because it is moving to a local health decision. We don't know of anyone at this point who's doing it across their entire school system, but there's certainly environments within schools where they're doing it. In fact, the guidance still says in kind of clinical settings, so nursing offices, and there might be some smaller districts or smaller schools or even individual classrooms where you have immunocompromised individuals where they've made a decision to mask the individuals there. So case by case, but not anything broad in any district or any school that we are aware of.
And quickly, Superintendent, you have some youngsters in the school system. Are they wearing a mask this week?
Well, not so young. High school students, my kids have chosen to continue to wear face coverings while they're in classrooms. I will say personally for me, in isolated environments like my office here, I won't be wearing it, but in the grocery store, I still did all weekend and will continue to do so in sort of mass gathering settings. But it's everyone's individual choice now, and we've got to really be on top of this to help each other out. And I'm going to reiterate again, at only 38% vaccination from 5 to 12-year-olds, it's one of the best things we could do to protect our children and each other is just increase those vaccinations and go get your booster. It looks like it's going to be an annual thing to get a booster. Please do so.
Superintendent Chris Reykdal, thanks so much for your time and for joining us this morning. Always great to see you.